All right, so we had our first nice snowstorm of the season up here in the Wasatch, and just trying to get out after it and get a hike and a run in. And I thought what we could talk about today is just a little bit about organism classification, kind of a rubric I use to keep track of things, especially when I'm trying to generate a differential diagnosis, thinking about what kind of pathogen we need to really be testing for, treating for, addressing in a sick child. So, by way of example, the first thing we're going to think about is we have a young child coming in, fever, rash, lots of vague symptoms that are non-specific, can represent a lot of different things. And the challenge is we have to generate a really broad differential diagnosis. This could be anything at this point. So we want some kind of organized schema to really apply our minds along. Now, a lot of us in medical school, we learn things like vitamin C, D, E, thinking about vascular causes and congenital causes and so on and so forth. That's only useful to a point when we're dealing with something that's obviously an infection or autoimmune or autoinflammatory condition. Doesn't do us a whole lot of good to start naming, for example, iatrogenic things. So if I'm consulted on a patient, usually what I try to do is I think about the different pathogens that could be players here, and I think about their size. And I start at the bottom with viruses and move on up. So let's classify some organisms. Let's think about it. So first of all, our viruses, right? We're on the nanometer scale of things, right? If a meter is about 3 feet long, shrink that down past the thousandths, past the millionths, way down to the nanometer size of things. And a virus is typically about a dozen nanometers in size. They're so small, you could fit about 50 million viral particles on the head of a pin. Viruses aren't truly organisms. They're not truly living things because they can't replicate on their own. They don't consist of cells. They're actually just a piece of nucleic acid, like RNA or DNA, that's tucked inside of a protein capsule for the most part. And because of this, viruses can only replicate by infecting other cells, hijacking the cellular machinery, and then using those to create more viruses. It's easy to anthropomorphize a virus and say that it wants to or it hijacks a cell. That's not truly what's happening. These are all just results of natural selection and evolution. But for us, it's easier to talk about them in this way. So the kinds of viruses that I have to deal with, or that I have to think about in my job, are stuff that most people have to think about too. Cold viruses, influenza virus, coronavirus, SARS-CoV-2, things of that nature. But there's also some more interesting ones as an infectious disease doctor I have to think about and take into account. And those are viruses like HIV, those are viruses like enteroviruses, vaccine preventable viruses like measles, mumps, rubella. All of these are examples. Now, the tricky thing about treating viruses is we don't have good antimicrobials for tackling them, or at least not many. Really, the success story in antimicrobial discovery has been in treating bacteria. We'll talk more about antibiotics later. But for viruses, we just have classes of drugs that we call antivirals. And those things are acyclovir for treating herpes outbreaks, or ganciclovir for treating cytomegalovirus. There's not a lot of amazing antivirals out there. We have a few, Tamiflu for flu, but otherwise they're generally okay. Really, the best way to treat any viral infection in a human being is make sure that human being has a good working immune system. That's our main adaptation to fighting off viral infections, is our adaptive immune system. When we move up the size of things and we go from viruses to bacteria, now we're going from nanometers to micrometers, or sometimes what we call microns for short. A lot of different bacteria to think about, the world is literally coated in bacteria. You know, when I'm hiking on this trail, if I were to take culture swabs of this trail, I could grow all kinds of stuff. If I were to swab my skin, my nose, my pores, anything else on a human being, I'd grow tons of stuff. And for the most part, a lot of it belongs there. It's natural. It's the flora of the environment. It's as natural as all the weeds and trees growing on this hill. Oh, really, they're kind of dormant because we're kicking off winter. But for the most part, they're not invasive, and they're what we call commensals, which is Latin for eats at the same table. They're just kind of sharing our environment with us. Bacteria are relatively simple-celled organisms. They don't really have all the fancy machinery that we eukaryotes have, like a nucleus. For the most part, they're just DNA bundled up inside of a cell. They might have a cell wall, and they replicate pretty rapidly, which means when we do get some bad actors in our bloodstream, infecting a piece of hardware or tissue, the trail's kind of slippery, they grow quickly. They cause major problems. They cause sepsis, can cause meningitis, a lot of issues. But fortunately for us, we have antibiotics to treat bacteria. Like I said, that's the success story of antimicrobials, is we have penicillin and doxycycline and Bactrim and all kinds of others of that nature. I'll talk more about those in another video. And trail's a little slippery. Now we're gonna get to a steep section here. So as you can tell, I'm already panting a little bit. So I'm gonna shut up for a second, get up there, and then we'll resume chatting. So keep moving. After the bacteria, we get to the eukaryotes, right? And easiest one to think about first is gonna be fungi. Now, that kingdom's actually pretty broad. Contains a lot of different organisms. Everything from yeast to the mold that grows on your bread. For the most part, fungi, pretty benign little guys. They don't hurt anybody. In fact, if anything, they help break down tons of dead materials in the environment. In fact, some of them actually live within us quite peacefully. That'd be species like Candida albicans, which you can find in most people's GI tracts. But for those of us with weakened immune systems, because we had a bone marrow transplant, because you know we're a newborn baby in the newborn ICU, Candida and other fungi, especially the molds, can cause a lot of issues. In fact, when I'm digging in the garden, I'm probably inhaling mold spores every day. Since I have a healthy immune system, it's not going to affect me. But if I have a weakened immune system, say I'm undergoing chemotherapy for leukemia, this fungi can cause a lot of problems. We do have some good antifungals. Those are things like voriconazole. You may have heard of tufactin, tenactin, topical antifungals, and even the dreaded amphotericin. And they can get the job done. But just like with viruses, and I didn't mention it, but just like with bacteria, honestly, your best weapon in fighting a fungal infection is a healthy immune system. All right, last but not least, kind of lump all the protozoa and parasites like roundworms all together. They're not usually what we have to deal with. Usually those are concerns if somebody's coming from a very low resource background, often kind of a global health tropical medicine concern. But protozoa, again, these are eukaryotes. They have more complex cellular machinery like nuclei, Golgi apparatus, mitochondria, powerhouse of the cell, all that stuff you learned in undergrad. Those are going to be things like Plasmodium, right? Malaria species. Those are going to be things like Trypanosoma, Chagas disease. Even things like amoebiasis, right? If somebody gets an infection with amoebas or the dreaded Naegleria fowleri, the brain-eating amoeba you can get if warm fresh water goes up your nose, that's where these guys go, is in that category of protozoa. Finally, we have the worms, cestodes, nematodes, trematodes. So these are going to include everyone's favorite tapeworms, right? So pork tapeworms, like the one that might have died inside the Secretary of Health's brain, according to popular media reports. Also, nematodes, roundworms, Ascaris, right? The most common worm infection in the world. So when it comes to fighting parasitic infections, protozoal infections, we've got some good classic weapons in our arsenal. Anti-malarial drugs, right? Quinine, chloroquine. In terms of fighting the worms, with things like ivermectin, which, yes, for all the controversy it caused a few years ago, it is a good anti-worm treatment. And also albendazole, mebendazole, and so forth. A lot of worms are particularly well adapted to human hosts, probably because they've been with us for thousands, if not millions of years. So as a result, there's a lot of asymptomatic people who have these parasitic infections. For the most part, healthy diet, good sanitation eliminates them, but they can pop up here and there. Well, that's sort of a 10,000 foot view, how I often think through organisms and classify them. We'll talk more about each of these things in particular. That's kind of a nice quick sketch of some of the thoughts that we have as infectious disease doctors, especially when we're generating a differential diagnosis. So, thanks for joining me, and I'll see you out there.